Hello, beautiful people. We will talk about the virus, which is considered one of the most dangerous viruses due to a mortality rate of up to 88%, and the lack of treatment or vaccine, which caused station services to be delayed when symptoms of the Marburg virus were detected in 2 people boarding a train in Germany. With the announcement of the Marburg virus outbreak by the World Health Organization in Ghana, there is also a rapid increase in studies and research on the Marburg virus. Please don't forget to subscribe and like for more content while continuing with the video. Marburg virus, or Marburg fever, is a type of virus that causes an infectious disease that is similar to the Ebola virus and can be extremely fatal. The fact that 2 male patients in Ghana had the same symptoms in June, and blood samples taken from 2 patients were examined in a laboratory environment, resulting in the understanding that the patients were infected with the Marburg virus and that many people were infected with the disease in a short time, increases the concern that the virus may spread in a short time in the world public opinion. After contact with a patient infected with Marburg or a contaminated surface, the first symptoms of the disease appear on average within 5 to 10 days. There are cases where it is seen that the incubation period of the virus is shorter than 5 days and longer than 10 days, according to the response of the person's immune system. According to World Health Organization data, the incubation period of the virus varies from 2 to 21 days. December. Symptoms of the disease are usually 7 after contact. It reaches a serious level per day. The symptoms of Marburg virus or Marburg fever are similar to the Ebola virus, one of the hemorrhagic fever diseases. Some of these symptoms can be listed as follows. Symptoms of Marburg virus appear suddenly after the incubation period of the disease. A persistent high fever that starts suddenly and cannot be reduced is one of the first symptoms of the disease. Tremor attacks that increase especially at night are another of the symptoms of the disease. Most patients infected with the Marburg virus experience headaches. In addition, back pain, November-October muscle and joint pain are also symptoms of the disease. In some patients, Marburg fever may involve the gastrointestinal tract, and these patients may experience symptoms such as abdominal pain, diarrhea, and nausea. Patients may experience intense weakness and fatigue throughout Marburg fever. Skin rashes that occur in the chest, back, and abdominal area of patients are also symptoms of the disease. The disease is within the group of diseases defined as hemorrhagic fever disease. People infected with the virus may have sudden bleeding in the veins. If the disease progresses, these hemorrhages can spread throughout the body. Marburg fever may involve the central nervous system in some patients. These patients may experience symptoms such as tension, irritability, forgetfulness. Symptoms may become increasingly severe in infected patients, and multiple organ failure may occur due to pancreatic, liver, and kidney problems. If the disease progresses, shock may develop in patients and the patient may lose his life. According to the World Health Organization, death in severe cases is usually 8 after the onset of symptoms. And 9, it occurs due to heavy blood loss per day. The authorities of the Ministry of Health of the Republic of Turkey recommend that people who have visited regions such as Central Africa and Uganda and show any of these symptoms on their return to isolate themselves from other people against Marburg fever and consult a doctor as soon as possible. If you need to examine the part of what is the Marburg virus, first of all, while humanity has been struggling with the COVID-19 pandemic for more than 2 years, the occurrence of Marburg virus in 2 male patients in Ghana in June 2022 shows that the authorities of all countries, especially the health authorities of Central African countries, should be cautious in the face of viruses. Marburg fever is a type of virus belonging to the filovirus family. With this feature, it is similar to the Ebola virus, which is a member of the same family. The Marburg virus is also a virus that causes hemorrhagic fever in humans, such as Ebola, and primates, such as chimpanzees. Marburg fever is a virus first identified in Yugoslavia, Germany, and Marburg in 1967, and it is known that the majority of people infected with the virus are in close contact with African green monkeys or bats. Viruses are small infectious agents that cause diseases in living things. It is quite primitive in structure because they do not show a cell structure. The nucleic acid they contain holds an important place in the classification of viruses. Viruses are classified as DNA, or RNA viruses according to their chromosomal structure. Marburg virus, or Marburg fever, is an RNA virus by structure. Studies on virology show that the structure of RNA viruses, such as Marburg, Ebola, or coronavirus, is more complex than DNA viruses, can be transmitted much faster, and is more difficult to treat because it can undergo more mutations. It is still unclear today how the patient who was first infected with the Marburg virus came into contact with the virus. However, 2 patients who came into contact with bat feces during a trip to Uganda in 2008 and were subsequently diagnosed with Marburg fever show that the main source of transmission of the virus is the environments where bats are found. It is believed that the way the virus spreads between people is by direct contact with a patient infected with the virus. December. It can be transmitted by contact, inhalation of droplets scattered around from the patient, contact with blood and body fluids, or by touching materials contaminated with the patient's body fluids. So what are the ways to protect yourself from the Marburg virus? First of all, those traveling to regions such as Uganda, Central Africa, where Marburg fever has been identified, should know that they are at risk of Marburg virus. Since there is no vaccine for the disease, the most effective way to protect yourself from the disease is to stay away from sick animals, humans, and African fruit bats living in Central Africa for the time being. In addition, to protect against the disease, hands should be washed frequently with soapy water and, if possible, disinfected regularly with disinfectants containing alcohol. The World Health Organization also warns health workers who live in these regions and are in close contact with patients to be careful. These people should use protective equipment such as gloves, glasses, masks in contact with patients and change their equipment after each patient. In addition, it is recommended that healthcare professionals wash their hands frequently and avoid being in close contact with patients as much as possible. October. According to the data of the World Health Organization, approximately 10% of those who died from Marburg fever infection are health workers. The Marburg virus is considered one of the most dangerous viruses due to its mortality rate of up to 88% and the lack of treatment or vaccines. We have reached the end of the video. Don't forget to subscribe to see the new video. Goodbye!